Right. Thank you everyone for joining us for a virtual discussion sponsored by Aurinia. It's wonderful that y'all will be here today. Please note that this educational program is for educational purposes only. Please speak with your physician before starting or stopping any new medications or adding anything into your lupus management plan. Some house rules: please mute yourself. Please turn your video off. If you have questions, please enter them into the chat box at the bottom of your screen. You can do that throughout the program and we will get to them at the end. We'll do questions at the end of the program. Again, this program is recorded, so if you don't want to be on the recording, please change your name. And then if you have any questions, again, please put them in the chat box. I will turn it over to Ms. Catherine.
Thank you, Adrienne. I appreciate it. Good morning, everyone. My name is Catherine Thorson. Make sure I'm not there. Okay, and I'd like to welcome you to today's virtual discussion, Bringing the Fight to Lupus Nephritis, sponsored by Aurinia. Before we begin, let me cover a few program details. This program is scheduled to last about 60 minutes. To ensure that you can view all content within this event, please make sure that your event window is maximized. We will have a Q&A session following the presentation and will take as many questions as time allows. You may enter your questions at any time during the presentation by typing them directly into the Q&A box at the bottom of your screen. Please keep your questions general in nature and refer to any specific questions about your health or treatment to your personal healthcare team. Today, we are going to talk about lupus nephritis and discover a treatment option to help bring the fight to people living with active lupus nephritis. Before getting into the treatment option, it is my pleasure to introduce our first speaker for today's program, Melissa. Melissa is a Lupinus ambassador acting on behalf of Aurinia and is being compensated by Aurinia for her time today. Melissa is currently taking Lupinus and today wanted to share her real life experiences taking Lupinus, as well as her experience with the Aurinia Alliance program throughout her Lupinus treatment journey. Thank you, Melissa, for being here today to share your lupus nephritis story and experience taking Lupinus. You may begin when you are ready.
Thank you, Catherine, for inviting me, and thank you, everyone. And I will be sharing my story today. Mommy's in bed. Mommy's not feeling well. Mommy needs her rest. That is what we told our kids when my symptoms first began. My husband did a good job of keeping them busy and distracting them. But as they grew, so did their curiosity. Mommy, we want to go outside, they'd say, peeking around our bedroom door, or watching me from the hallway while I vomited in the bathroom. And as always, my heart would sink as I heard myself reply, just not today. Hi, my name is Melissa McFall, and I'd like to thank Aurinia Pharmaceuticals for sponsoring me to share my story with you today about living with lupus nephritis. I believe that everyone can foster a meaningful life. With a little faith, hope, and determination, you can pursue your dreams and make your own way in the world. But one day, all that changed. My faith was challenged, my hope shattered, and my dreams put on hold. It started when I was in graduate school. I was working full-time as a wife and a new mother when I began noticing that I was overly fatigued. I figured it might just be because I was so busy. But no matter how much I slept, I didn't feel rested. After a few consultations with my doctor, I was told that I needed to find some balance in my life. I needed to rest and make some modifications to my lifestyle, such as exercising and eating well. But despite my busy schedule, I already took care of myself, so the idea that it was simply a matter of lifestyle didn't really feel complete to me. I decided to see a specialist just to make sure that the fatigue wasn't associated with anything more serious. He said that my symptoms were a mystery to him, but that he thought I might have some sort of connective tissue disease. I didn't know what that meant, but I followed his recommendations regardless. He gave me some nutritional supplements and also suggested lifestyle changes. So I modified my diet and began to fit in more exercise time. Not too long after, my fatigue seemed to subside a little, though it never went away. And a few months later, my life was turned upside down. One morning, I got a call that my sister hadn't picked her kids up from their nanny for a few days. I knew that wasn't right. I left work immediately and went straight to her house. There was garbage piled up out front. I knocked, no answer. I knocked again, no answer. I felt my heartbeat slamming through my chest. When I rushed inside, I found her unconscious. She had a stroke and had been lying on the living room floor for 3 days. I drove her to the hospital where she initially recovered. It seemed like everything might be all right, but only a few short months later, I received the news that she passed away. Right before she died, her doctors had diagnosed her with lupus. At the time, I didn't follow that thread. I was struck by my grief. My baby sister was a very beautiful person, and we were very close. She was so young, she had kids. It was hard for me to accept that her plans for her life, sorry guys, sorry, would never be fulfilled. I felt like I was living in a nightmare. And not long after her death, I experienced my most painful symptoms yet. It wasn't just fatigue. I was sore all over. I could not move. I could not do things on my own. And I remember thinking to myself, God, what is this? Why me? Of course, I wanted to be seen by doctors. I knew this wasn't the usual fatigue or muscular pain, but back then I was working as a contracted therapist and I didn't have health insurance. Still, I was determined, so I paid out of pocket to see a doctor after doctor and after doctor. The misdiagnosis and dead ends seemed endless. The list of possible causes was long and confusing. Everything from carpal tunnel to HIV. Time and time again, I was either referred elsewhere or told that all my test results were in normal ranges. I felt so diminished. My symptoms were becoming unmanageable, and now I truly felt like there was no light at the end of the tunnel. I could barely look at myself in the mirror. I was at an all-time low. My hair was falling out and my skin was erupting in red patches everywhere, all over my face. I became unrecognizable. I've never felt so insecure about my appearance before, but suddenly I didn't know the person staring back at me. It was like I was looking into the future and one I wasn't sure I wanted. My kids and my husband were worried. What's wrong with mommy? They'd ask him. Is she gonna stay in bed all day? I heard them say. One night, my daughter spied on me when I was sick in my bathroom again. The next day, she complained of an upset tummy too. I heard her in my arms and she looked at me with a frown. I guess I'm sick now too. Mommy, I'm sorry. She has always felt other people's emotions as if they were her own. But I didn't want to be the sick mom. I didn't want to stay in bed and miss the rest of their lives. I was at the end of my patience. I couldn't handle the extreme itching, joint pain, or hair loss anymore. I couldn't handle the fact that I was deteriorating and that I wasn't myself anymore. Desperate, I decided to seek out a dermatologist. The dermatologist took her time, and after an exam and some tests, I was finally diagnosed with lupus. It was a relief, but also terrifying. Of course, now I was able to get the medications that I needed to deal with my symptoms. But the only people I ever met who had lupus, my sister and one girl I knew growing up, had both died of it. Is this my destiny, I wonder? Will this be my end, to leave behind a husband and 2 young children? I was willing to change my life to get better. I tried to change my perspective and the way I ate and slept. But would this be enough? After a few years of routine testing and struggling to find the right management approach for my lupus, my rheumatologist saw protein in my urine. She waited to see how my kidneys were functioning before acting on the information. But in the meantime, I started to feel sicker. So I decided to switch healthcare providers because I was afraid my situation was more serious than my previous doctors were letting on. With my husband's help, I discussed my concerns with my new rheumatologist and nephrologist, and they recommended a kidney biopsy. The biopsy showed lupus nephritis. I was definitely scared about what that meant for me, but my doctors were on my side. I felt like I finally had the right connection with my healthcare providers. We were a team now, along with my husband, who always helped advocate for me in appointments when I needed it. I tried to bring him along for an extra set of ears too, when I can. Together, we discussed various treatment options, but the first one we tried was not the right fit for me. After sitting down and talking again, my team and I chose Lupinus to treat my lupus nephritis. When I first started taking Lupinus, I was assigned a nurse case manager through Urine Alliance. She called me and went over side effects, precautions, and dosing. She also helped me access Lupinus and answered my questions about insurance approval. Now she still checks in with me periodically to see how I'm doing and to make sure I get my prescriptions. She was absolutely awesome. Since starting Lupinus, I've noticed a change in my symptoms. I have experienced headaches, but this is my experience and everyone is different. The most common side effects of Lupinus include diarrhea, headaches, and cough. For dosing, I take Lupinus 3 times each morning and night as prescribed by my doctor. Now I still have bad days, but my symptoms are more manageable. I get lab work done every 6 to 8 weeks and check in with my rheumatologist often. He told me that my protein levels appear to have decreased. I feel less fatigue, which for me means that I can spend time outside with the kids, provided we're not in the sun the entire day. It feels good to be the fun mom again. It took a long time to get where I am today, but my hope has returned. A little dented, sure, but not broken. My faith has recovered and my sense of self is back, full force. Now when I see the woman looking back at me in the mirror, I see someone strong and courageous, maybe with a scarf on my head, but always stylish. I've been through hard moments and many trials, but I believe that my willingness to change has allowed me to move forward. As I always say, life has a funny way of working itself out. So while we may not know what tomorrow brings, I know that I will get out of bed today, go to work, and play with my kids and enjoy my life. I am not the sick mom. I am just me. And today I am happy. Thank you.
Thank you, Melissa, for sharing your lupus nephritis and Lupinus treatment journey experience. Your journey is inspiring. Melissa will be with us until the end of the program to answer any questions that you may have for her. As a reminder, please type them directly into the Q&A at the bottom of your screen. I am now happy to introduce our new speaker, Dr. Clayton. Dr. Clayton is a managing partner of Rheumatology Associates of Del Mar Vera. Dr. Clayton, you may begin.
Thanks so much. I just want to say thank you to Melissa for that. That was incredible. I'm so sorry about your sister, and I'm so honored to follow you in this talk. That people like you are why I do what I do, and companies like Urine do what they do. And we are so honored to have you here. And I feel like I pale in comparison following you. So I'm so happy you're doing well. So today we are going to talk about lupus nephritis, as well as new treatment options for it. There we go. Sorry. So we're going to discuss the first and only FDA-approved oral treatment for lupus nephritis, which is Lupinus. This is a prescription medication that needs to be used in conjunction with other medications to treat active lupus nephritis. It shouldn't be used with a medication called cyclophosphamide, which you'll hear me say this multiple times throughout the program. It hasn't been studied with this drug, and I'm sure some of you who have nephritis who are on the call are familiar with this medication. Obviously, what we talk about here is important for you to use as discussion points to discuss with your healthcare provider and your rheumatologist. So we start all these talks with intimidating information, so don't be overwhelmed. But this is from the package insert on the drug. So this is kind of the big picture immunosuppressant type warning. Some of these risks that we'll talk about are not necessarily specific to Lupinus, but because this drug fits into a category of medications that we consider immunosuppressants, it is a class effect that we talk about, including risk for cancer and risk for infection. So all immunosuppressants come with these warnings, specifically skin and lymph node cancers or lymphomas. I think the lupus patients are very familiar with avoiding UV exposure, but we advise everybody on the drug to do that just because of the risk for skin cancers. Infection risk is a very real risk, so this is an immunosuppressant effect as well. And I mean, you're inhibiting a part of the immune system that is not properly working, but you're also inhibiting the normal part of the immune system as well. And obviously, if there are any signs or symptoms of infection during your treatment course, you need to contact your healthcare provider. There are certain medications that you need to avoid if you're on Lupinus. There are classes of medications called strong CYP3A4 inhibitors, which you can see listed here at the bottom. So there's some antifungals on there, an antibiotic as well. Obviously, I hate saying this, but if you're allergic to the medication, you shouldn't take it. And in the same way that we talk about these strong CYP3A4 inhibitors, grapefruit juice and eating grapefruit fits into that category as well. So we advise to avoid that. We always encourage, at least in my practice, I'm sure most providers are like this, kind of a full open discussion disclosure about all health issues. So making sure that you're giving your healthcare provider all the information, even if they're not asking you the question specifically, including about vaccine planning. If you're planning for anything or you've just gotten any vaccines, you should not get live vaccines while you're on Lupinus. Thankfully, there's not a lot of live vaccines on the market currently that are being used. Killed vaccines are safe, but we don't have data to say whether they're actually working properly, but they are safe to get while you're on the medication. Obviously, your provider is going to know if you have liver, kidney, heart issues, high blood pressure, but making sure you're having an active discussion about that's very important. And then I think this is also another no-brainer for a lot of our younger lupus patients, but pregnancy and breastfeeding planning is incredibly important because that helps to guide treatment options. A lot of the options we have for treating lupus and lupus nephritis are not safe in pregnancy, and Lupinus is not approved to be used during pregnancy. Obviously, disclosing all of your medications is important. And I think it oftentimes gets overlooked, kind of nutrient supplements, over-the-counter type things, all of that's important as well. So today's talk, as I'm not advancing, sorry. Today's talk is going to be 3 parts. So we will talk about lupus nephritis first, kind of get the idea of what that is, who it affects, and the big picture of the disease and how we diagnose it. And then we'll get into the details of the clinical trials of Lupinus. And then the third part is going to be kind of the logistics of taking Lupinus. So to get some background knowledge about lupus nephritis, so nephritis is inflammation of the nephrons, so nephritis, right? Anything with itis is inflammation. Nephrons are the filtering unit, the microscopic filtering unit of the kidney. So this is a common complication of lupus. About 45% of lupus patients will go on to develop nephritis. And it is mediated by the immune system having a signal by antibodies to attack that filtering unit of the kidney and cause a big inflammatory response. This can lead to permanent and irreversible damage to the kidneys. If it goes untreated, it can lead to kidney failure, which that's a fancy term of saying dialysis or kidney transplant. So who are the target population that's at risk for lupus nephritis? So like I said, up to 1 in 2 people with lupus can go on to develop nephritis. This is 4 times more common in people of African and Asian descent, and 2 times more common in Hispanic and Native peoples. So signs and symptoms of the disease. So signs are what you physically observe on a physical exam. Symptoms are obviously what you would experience. And the symptoms can be varied, the timelines can be varied. And like we always say in lupus, this is a very heterogeneous disease. So how one person like Militia presents is not going to be the same as how someone else would present. But common is swelling, typically in dependent areas, meaning gravity dependent areas, kind of in the feet, ankles, legs. If it's significant enough, it can be in the hands, face, and then even up to the abdomen sometimes. Foamy or frothy urine can sometimes be a sign, and that can indicate that there's a lot of protein in the urine. Obviously, knowing what your urine normally looks like is important. And then increases in blood pressure that are unexplained. And then frequent urination, typically reported overnight. The symptoms, like I said, can be all of these. It can be more than this. It can be very minimal, and in a very scary way, it can be asymptomatic as well. Symptoms can come and go or just be very subtle, so much so that sometimes patients miss them or providers don't anticipate lupus nephritis because the symptoms are so mild. So what do we look for when we are evaluating a patient? When I see a lupus patient in the office who comes in and I want to make sure that there's nothing going on with their kidneys, we look for 2 main things through urine testing. So blood in the urine, which we call hematuria, and protein in the urine, which is proteinuria. Proteinuria is the single biggest important predictor here, because treatment and how people respond to the protein, or how their disease responds with dropping protein in their urine, helps us determine who does well long term. So looking at proteinuria is very important. In most lupus patients, people who are diagnosed with systemic lupus but don't have nephritis yet, they're usually monitored every 3 to 6 months. If there's a high suspicion or there are disease-related factors like certain antibodies or certain family history, for example, the testing is usually more frequent, and this can happen every 1 to 3 months. It's very patient-specific, so talk to your provider about what they would recommend as far as your need for screening. And we look to make sure urine protein levels remain at an acceptable range, which is typically lower than 0.5 grams per day. There's exceptions to this based on what your other disease processes are or any other issues may be, but in general, we want it to be less than 0.5 grams per day. The important part about all of this testing is so that we can identify patients with the disease early so we can treat them early. So diagnosis is made based on multiple things. Signs and symptoms are kind of what lead up to the testing, but we look at urine, blood, and kidney specimens, so biopsy. So in urine, obviously, we're looking for protein, and blood tells us how well the kidneys are filtering. The fact that protein may be entering the urine tells us that the nephron, that filtering component of the kidney, isn't functioning properly and it's leaking. Blood work gives us some important indices for how well the kidney's doing overall. So looking at creatinine, which is a product the kidney should be filtering out and you should be eliminating in your urine. If that creatinine starts to rise, it means that you're not filtering in the nephron properly, and your levels of creatinine are building up, telling us something's going on in the kidney. Creatinine can be elevated on diagnosis, but doesn't have to be necessarily. And that gives us kind of a generalized idea of how well the kidney's doing. Kidney biopsy is by far and away the gold standard of how we make this diagnosis, right? So you get a ultrasound guided biopsy and we look at it under the microscope to blow up that nephron and see if it's actually infiltrated with inflammatory cells. This confirms the diagnosis, and it gives us an idea of how extensive the disease is. You can gauge how severe and damaged the kidney is on the biopsy. So just to summarize kind of where we've been with the disease process, lupus nephritis is one of the most severe complications of lupus. About 45 to 50% of patients with lupus can develop this. It can damage the kidneys. And as we know, those are the filtering kind of cleanup organ of the body. So if you're not able to filter properly, it can lead to multiple downstream complications. So increased blood pressure, chronic kidney disease, which we think of as a stepwise progression to end-stage kidney failure, which is long-term scarring of the kidney, and then the need for dialysis or transplant. So identifying patients early and biopsying them early and then treating them early is the most important take-home point here. So first-line treatment of lupus nephritis is always steroids. And just to take a couple steps back, I'm sure a lot of you guys who are on the call, if you have lupus, you are very familiar with steroids. Most patients are. I always tell patients steroids are the cleanup man. So I liken active disease processes to a barn that the doors are open and all the animals are out, and steroids come and they clean everything up and put the animals back in the barn, but they don't actually close the doors, right? So they, as soon as you start to take them away, the animals all get out and the disease process starts up again. So they're kind of like the cleanup man, but they don't actually stop the process, right? They're not pumping the brakes on the immune process that's targeting the kidney. So steroids come with long-term risks, no secret there. And relying on a high dose of steroids will increase lots of complications long-term. So irreversible types of organ damage, cardiovascular risk is a very big risk in your population. And we think, when we think of a cutoff number for steroids, we think of higher dose steroids being greater than or equal to 7.5 milligrams per day, being that group that's going to be putting themselves at higher risk for damage. I think this number is very contested in the medical literature, and I feel like it's constantly going back and forth what the cutoff number should be. But a good way to frame this and how I kind of compartmentalize for a specific patient what their risk is this box to the right. So every 1 milligram increase in average daily steroid dose can increase risk for new organ damage by up to 3%. So if you've been on steroids, think about being on 20 or 40 of prednisone for X amount of time, and think about how that compounds with that percentage risk over time. Not great, right? I think we can do better than just steroids. So treating the background disease process is the most important part here. Steroids, again, are coming in to swoop in and save the day and acutely calm things down, but you actually need to get at the underlying issue. So the goal is to reduce that inflammatory assault on the kidney to get the disease process under control. That will also help to prevent further damage and avoid long-term kidney failure, which is obviously our end goal. So it's an exciting time for lupus because now there are FDA-approved treatments for lupus nephritis. Until earlier this year, there weren't any approved treatments for lupus nephritis, which I know is mind-blowing in that we have other older treatments that we've used over the years. So Lupinus is the first FDA-approved oral treatment that's specific for lupus nephritis. So Lupinus, again, first FDA-approved oral medicine. That's a big selling point here to talk about, just because some of the other treatments that you'll hear about are usually IV therapies. It should not be taken with cyclophosphamide, which is one of the original IV therapies that was studied. Some of you have probably been on that before. And obviously, this is a careful discussion that needs to be had between you and your rheumatologist or nephrologist. So Lupinus is going to help stop the attack on the kidneys in an effort to get the overall disease process under better control. It has been shown to work without the need for long-term high-dose steroids. I think that is one of the very big points of our talk, is that we want to both control the disease process, but stop the long-term risks from medications, which has been a burden over the many years of treating lupus nephritis until now. So our goal is to reduce the protein in the urine, as I discussed earlier, and that's going to happen faster with Lupinus and mycophenolate together than with mycophenolate and steroids alone. So Lupinus is given with one of the traditional treatments, which is mycophenolate mofetil, and a steroid taper. So another summary here. So lupus nephritis, common and serious complication of lupus. Up to 50% of lupus patients can develop this. Patients with systemic lupus should be routinely screened for nephritis. And the decision about how frequently to do that depends on your specific situation, your antibody status, and other features that you and your doctor can work out. On average, this tends to be every 3 to 6 months in lupus patients. Patients with active nephritis, that's a very different scenario. So you should be screened at least monthly in the beginning of treatment, if not more frequently than that, kind of depending on what the status of the kidney function is. Lupinus is specifically approved for lupus nephritis and helps to control it and prevent further damage. So there's a great discussion guide or doctor discussion guide on lupinus.com that you can check out as well to give you some discussion prompts to review with your provider. So let's get into the details of the trials in Lupinus, just to give you an idea of the data that we're looking at about how well this drug works. So again, I always tell you guys, there's a lot of belabored points in this PowerPoint. So first, FDA approved oral medication for lupus nephritis. So it's been shown to control lupus nephritis and help protect the kidneys from further damage without the use of high-dose steroids when it's combined with mycophenolate. So it's a very cool drug, and says the rheumatologist, right? We are kind of a geeky crowd, I know. So it has a twofold mechanism of action, which makes it distinct from a lot of the other therapies that you'll hear about. So it helps to stop that inflammatory attack on the kidney with its immunosuppressant effect, right? It's pumping the brakes on those abnormal signals the immune system is sending to target inflammation to the kidney filtering mechanism. The added benefit of Lupinus is that it helps to prevent the kidneys from becoming damaged. And that is because it helps to stabilize some of the cells in the filtering mechanism that have abnormal structure and have become leaky. We call those podocytes. They're these foot processes around the nephron that help with filtering. With helping to stabilize them, you help to stop the dumping of protein, and that can help long-term with better outcomes. So it's an interesting mechanism of action, different from anything else we've used previously for lupus nephritis. So it was looked at in over 350 people across different races and ethnicities in different countries. And it showed that Lupinus helped to get lupus nephritis under control and worked without high-dose steroids while reducing proteinuria. So those in the Lupinus group, after 1 year of treatment with Lupinus and mycophenolate, had a 3 times greater improvement, or 3 times greater likelihood of being in remission than those who were just on mycophenolate and steroids alone. Just to kind of take a step back, mycophenolate is kind of the standard of care that we would consider. I'm sure if you've had nephritis, you're very familiar with it. It's been used for many years. And I think the data that, if you look at the original mycophenolate data, there are people who do well on it, but it's a lower percentage of patients than we saw comparing it to this study with Lupinus. So important is that it worked without having to use high-dose steroids for long periods of time. So in general, this was a lower dose steroid taper than we've seen previously, which is always reassuring, right? Less is more when it comes to steroids. It works to reduce the proteinuria, which is important to control both the disease process, but also those long-term outcomes that we talk about, kind of avoiding that progression to end-stage renal disease. So it helped to reduce protein in the urine 2 times faster than mycophenolate and steroids alone. You can see this graphically represented over to the right. So controlling urine protein in about 6 months to what we would consider complete remission, which is normalization, to about 1 year with mycophenolate and steroids alone. So I think it's important to also look at the big picture that the faster you reduce the proteinuria, the more dramatically you reduce it, the better the long-term outcomes for the patients. And we've replicated that over and over again over the years in various studies. So people taking Lupinus saw a 50% reduction of proteinuria after just 1 month on average. And I can tell you from my own personal experience using this drug in patients, that's about what I've seen as well, which is very encouraging. A lot of our more traditional treatments take a lot longer and they're a lot slower in how they're giving benefit. But the speed with which you reduce that proteinuria and how dramatically you reduce it, again, is very important for the long-term outcomes. So before starting Lupinus, more points to belabor for you guys about cyclophosphamide. So shouldn't be combined together. Always disclose pregnancy planning. That is something that I have discussions about every day in the office with every lupus patient that comes in. Any breastfeeding plans as well, because that will alter what treatment regimen is available to you. Don't take with strong CYP3A4 inhibitors like we discussed, they're listed here. And then obviously if you're allergic to voclosporin, which is the generic name for Lupinus, or any ingredients that are in Lupinus specifically, please avoid taking the medication. Again, you can check out lupinus.com for any of the good discussion points or details about the medication in depth. So side effects is something we also belabor a lot, at least in my patient population, we have these discussions regularly. Lupinus is an immunosuppressant, so all that stuff I started off the talk with is relevant, not necessarily specific to the drug itself. But when we actually look at the clinical trials and see what was most commonly reported, you'll see that diarrhea, headache, cough, UTI, stomach upset, heartburn, and loss of hair were reported. Some of these more frequently than others, but in general, the medication's been very well tolerated in clinical studies and in my experience with patients. Obviously, discussion points to take to your doctor. I know that most patients, when they come in, especially if you have an active disease process like nephritis, you're being seen very frequently. And a lot of my patients keep symptom journals, which is really important. So reporting anything that's off from your normal is important. So if there's any new kidney problems that arise, or you're having issues with your blood pressure, if you have any neurologic type symptoms, confusion, headache, changes in mental status, etc., all important to disclose. If you've had any elevated potassium, now, most likely we're going to be the ones to know that because we'll usually be the ones managing your blood work. Or if you've had any serious heart arrhythmia problems. Lupinus is listed as having a risk for QT prolongation, which is it's a measure on an EKG that if it's too long, it can predispose to certain arrhythmias. And then if you've had severe low red blood cell counts or anemia, that's important to know too. So Lupinus really is helping to transform the way we approach and treat nephritis. It stops the attack on the kidneys, helps to reduce that big dramatic inflammatory response in the kidneys, also while protecting it from long-term damage. And also in the setting of not having to use high-dose steroids, all important high points here. So let's talk about the drug itself, how to take it, and some of the details of that. So it is specifically for lupus nephritis, not indicated for systemic lupus at this time, just nephritis. It will be taken with mycophenolate and steroids in a low taper to stop that attack, protect from irreversible damage, and it can help you to maintain kidney function and avoid those poor long-term outcomes that we've discussed. So dosing schedule depends on each specific patient, but in general, it is taken as 3 capsules twice daily by mouth. This is not an injection nor an infusion. The dosing schedule stays the same throughout your treatment course. There are exceptions to the dosing as far as other comorbidities or other medical issues that you may have. So it depends on those issues and your doctor's discretion. So taking it on an empty stomach is important. We want the doses to be as close to 12 hours as possible. Minimum of 8 hours between the doses. And if you miss a dose of Lupinus and you know within 4 hours that you've missed it, you can certainly take it. But if you go beyond that window, we ask that you just hold that dose and go to your next dose, which would be 12 hours after you were due. The reason for that is we want to avoid side effects from stacking doses too close together. Don't break, crush, chew, dissolve them. They are capsules, and always take as recommended by your doctor. So they come in blister packs. You can see over here to the right. Don't consolidate them when you get them. Don't take them all out and put them in a bottle. They need to stay in the blister packs for a reason so that the medication can stay stable and actually work. Don't put in any other container. So always take as prescribed. I think these are more no-brainer points, but I think these are important points to make. Always stay up to date with what's going on as far as keeping your doctor in the loop about symptoms, both at your visits and in between. Make sure you're keeping symptom journals. I like to make sure patients with lupus nephritis especially are very engaged in what's going on. There's nothing more gratifying to a patient than watching their labs normalize or watching things improve. So I'd encourage you guys to get patient logins for the EMR that your practices use, get LabCorp and whatever other logins you need, so you can watch these lab tests and see the fruits of your labor of making sure that you're staying up on things, taking your medicine, seeing your doctor, et cetera. You'll be getting urine and blood tests regularly when you're on the medication, looking for that urine protein to make sure we're seeing a decrease. We like to watch the glomerular filtration rate, or the GFR, which is a calculated number that comes from the creatinine that I discussed earlier. That gives us an idea of how healthy the kidneys are, if there's kind of long-term issues going on with them. It helps us know if there's any side effects as well. So I'm going to turn this over to Catherine to give you guys some information about Aurinia Alliance.
Thank you, Dr. Clayton. So Aurinia Alliance is a program specifically designed for people living with lupus nephritis and taking Lupinus as prescribed by their healthcare provider. It is designed to provide resources for people with the disease and their care partners. The program is staffed by registered nurses who have experience in insurance and funding issues. If you enroll in Aurinia Alliance, you will be connected with a nurse case manager who will be your dedicated contact throughout your treatment journey. The nurse case manager will help you learn more about lupus nephritis, assist you in navigating insurance options for Lupinus, and help you stay on track with your Lupinus treatment. Nurse case managers from Aurinia Alliance do not give medical advice and will direct patients to their healthcare provider for any disease treatment or referral related questions. Nurse case managers from Aurinia Alliance are available Monday through Friday, 8 a.m. to 8 p.m., and that is Eastern Standard Time. Next slide, please. Enrolling in Aurinia Alliance opens the door to dedicated support. Your nurse case manager will partner with your healthcare team to help initiate your Lupinus treatment and help you access everything the program has to offer, including educational resources, information about treatment, financial assistance, and working with your specialty pharmacy to fulfill your Lupinus prescription. After you are connected with a nurse case manager, they will be there every step of the way to help you stay on track with your Lupinus treatment. It is important to connect with your nurse case manager to get started on these next steps. They will contact you through your Lupinus treatment journey. If you are prescribed Lupinus, please add the phone number in your contact list. It is 1-833-287-4642. If someone from that number calls you, don't dismiss it as spam, because that is the number of your nurse case manager. And they will call you to complete your enrollment and coordinate with your doctor and insurance to help you get your prescription filled. So thank you, Dr. Clayton. I'll ask you to take us through the rest of the important safety information about Lupinus.
Sure. Okay, so this is the second half of the safety information that I started with in the beginning of the slide deck. So this is the more extensive list here. We can go through, I mean, this in a lot of detail, but I think a lot of it is kind of self-explanatory. So with Lupinus treatments, kidney issues on top of lupus nephritis have been reported in the clinical studies. These are usually mild and center around us monitoring to make sure that glomerular filtration rate is staying stable. A lot of the burden of monitoring that is going to be on us rather than you guys. High blood pressure can happen with Lupinus. This class of medications can cause vasoconstriction, which is kind of a clamping down of the blood vessels, and that can lead to systemic high blood pressure. So monitoring your blood pressure is very important. Obviously, we'll do that when you're in the office, but I encourage my patients to do that at home as well. Nervous system problems have been reported, not in a very high incidence, but you can see any of these symptoms listed here at the bottom should be reported to your rheumatologist. Elevated potassium levels as well, which that'll be monitored with your regular labs. And then any heart rhythm issues, the QT prolongation that I discussed. Severe low red blood cell counts or anemia or aplastic anemia is not specific to Lupinus. It's a class effect of this group of medicines that Lupinus belongs to. And then again, just to reiterate, the most common side effects are listed over here to the right. So diarrhea, headache, cough, UTI, stomach pain, heartburn, and loss of hair. There are obviously another laundry list of uncommon side effects that you can find online at lupinus.com. And then obviously you can review the entire package insert as well